I'm Adria Scharf. I'm part of the leadership team at the Rutgers Institute for the Study of Employee Ownership and Profit Sharing. And I am delighted to have the opportunity to moderate this important discussion focused on the role of employee ownership, worker ownership models, specifically in the health sector and the care providing sectors. This sector has been a particular interest of mine in my own research, and I'm excited to be joined today by Terrell Cannon and Katrina Kazda, Terry Leahy, and we'll introduce them in more detail in just a minute. But just wanted to frame out, just in a few words, sort of how I think about the importance of this question. And, you know, I would say that the way we structure ownership in the health sector really, really matters. And I think some previous speakers today, including Adria Powell, have really kind of set the stage for this conversation, laying out a number of themes related to the fact that we as a society insufficiently care for the people, the human beings who we ask to provide care to ourselves and to our loved ones, and the crisis in care work and the importance of democratic, high-road, shared ownership models that share dignity with frontline workers. Other speakers have also talked about the rapid growth in this sector. The health sector, care work, is one of the fastest growing kind of segments in terms of jobs. It's also, as Lauren just kind of alluded to with Forgotten Cities, you know, as we've seen the decline of the manufacturing sector, in many communities in the Rust Belt, increasingly the health systems, the health providers are the economic driver of the community and central to just establishing the economic foundation for entire localities. But a third reason that the structure of ownership in health matters to me is something really obvious, but that I think we just take for granted and forget sometimes as Americans, those of us who are Americans, which is just the fact that in the United States, the provision of health services and the provision of care services are commercialized and privatized to a much greater degree than in many other parts of the world. So here in the United States, we rely on for-profit businesses to provide many of the foundational health care needs, to meet our health care needs as a community, and yet the predominant models of ownership in the sector are often outside investor-owned models or structures of ownership that limit ownership to just one or two, a small number of individuals within the business. And employee ownership models are relatively rare. I think that within the kind of the healthcare pie chart, within the ESOP pie chart, among all ESOPs, ESOPs in healthcare and social assistance represent just 2% of all ESOPs overall, which is relatively small. But their examples are very important, and we'll hear from Terry in just a minute about the company he leads. In the universe of worker cooperatives, we heard earlier from Adria Powell and yesterday from JC about CHCA, which, as we know, is the largest worker cooperative in the country, one of the most robust and resilient and important models around. And I think it really stands out as an example and kind of a motivator for so many. And we'll hear more today about other models and some new innovations in the home care cooperative space. So with that, I would love to introduce our panelists. We have with us Terry Leahy, who is CEO of the ESOP company MyPath, Katrina Kazda, Vice President of Home Care Innovations, the ICA Group, and Terrell Cannon, Director of Training and Workforce Development, Home Care Associates of Philadelphia. And we will start by just inviting each of you to share a little bit about yourself and your employee ownership journey, a little bit about your own companies. So Terrell, let's start with you. Would you tell us about yourself and the history and the work of Home Care Associates?
Hi, everyone. Thank you again, Rutgers, Aspen, for inviting me to this space. I will not get this, Adria. But I am Terrell Cannon. I am a employee owner of Home Care Associates of Philadelphia. I came into this to this space in 1993, coming from a traditional workplace where I was not valued, respected, or even appreciated for the work that I did in providing care to the members of my community. When I got to Home Care Associates, it was very different, and coming into a space where my ideas, my voice, and I was offered to make the decisions and sit at the table with what I thought in a traditional workplace were the elites, to sit at the table with the elites to make the decisions for the company. And what I found at working at Home Care Associates is that I am the elite. And yes, snap, snap, snap. So with that and being in this space, I've grown from starting out as a young woman on public welfare, clocking in, clocking out, to now a business owner making decisions to expand my organization with my other colleagues and working collectively with other co-ops like Cooperative Home Care Associates of New York, who has provided us with the foundation to be here 30 years later. So,
Katrina, let's stick with home care cooperatives, and could you share a little bit about your work at ICA Group?
Yeah, sure. So I've been working with the ICA Group for a little over 8 years now. ICA has been involved in the home care cooperative space since the founding of Cooperative Home Care Associates in 1985, but we launched a formal program in 2018. And for a number of years, I was heading up that program, and have shifted over to focusing on our scaled initiatives, both nationally and state-based. But yeah, ICA sort of has its hands in all aspects of home care cooperatives, live and breathe it, both to my benefit and to my detriment, because I can't imagine working with a more amazing group of humans, really. It's an incredible, incredible space to work in, individuals like Terrell. And also, it is a very, very hard industry, and there are so many challenges and barriers that we're having to work through. But yeah, ICA's work really it kind of touches the whole space, from startup to strategic consulting and supporting existing cooperatives in their continued growth and stability. And as I said, now really looking at how do we grow and scale the sector, and really through that, the point of that is more employee ownership in the space, more control, and ultimately to transform the industry and the way that it operates.
Thank you. Terry, tell us about My Path.
Sure, and thanks again to Rutgers and the Institute for including myself and our company in this list of illustrious ESOP companies that I've heard about over the last 2 days. And I guess My Path is that unicorn. We are a traditional ESOP, but we're in a social services, human services space. And our company was founded 40 years ago. We had our 40th anniversary last fall. And our founder bought the assets of the company out of bankruptcy when he was 30 years old. Now, we have kids in their 30s who are still on their parents' cell phone plan. So the idea of thinking of one of them going out and taking the risk that Jim did is quite something. And Jim is a CPA, so he's a money guy, but he had worked in programs for people with disabilities as a teenager. And he had a passion for growing those programs, opening new programs, and that balance between mission and margin remains in the company to this day. So fast forward, at the time that he bought the assets of the company, we had a residential program for children with significant disabilities and 8 group homes for adults. And those 2 service lines became kind of the double helix of our DNA as an organization. So we replicated over the years, grew organically, and today we have 8 operating companies, each with a different focus, different regulators. But the common unifying strategy is that we focus on very high needs individuals, and we try and provide a continuum of care from childhood until end of life. So that means, for example, we have clinics for toddlers with autism. We have day schools for children with significant disabilities. We have community living settings for people with disabilities. So a whole range of services. We now have about 2,000 owners, and we're in 41 communities in Wisconsin and Indiana. and about 159 program locations. In our case, a program location could be anything from a large residential campus for children to a single person setting in the middle of nowhere in Wisconsin, staffed 24/7. So if you think about ESOPs and ESOP culture, that becomes part of the equation as to how do you communicate with that group. Just a few financial metrics, because it's not about the money, but it's kind of about the money with this audience. So we are at about 170 million in revenue run rate, and 12 to 13% of that is EBITDA. Our ESOP started in 2002 as a 2002 as a 30%. In 2016, we became 100% ESOP. Our share price has had a 12% compounded annual growth rate over that time. So we do have caregivers who have six-figure retirement accounts, which is amazing and something to be thankful for. So that's my intro.
That's great. Thank you. A few of us were talking earlier about kind of worker cooperatives and ESOPs and how we both kind of fold them together under this banner of employee ownership or worker ownership, and in some ways how different they are structurally. And so just back to Terry first, and then we'll turn to co-ops. I don't know if you could share just a little bit more about what ownership means to a worker, a care worker at MyPath, both in terms of sort of what you do to reinforce the culture and make people feel like owners. And then you mentioned just the financial benefit, but what does it really look like from the perspective of an ESOP participant to be an owner?
And maybe what I could do is we've taken some of the general themes of the conference about what it means to be an employee owner, and then give you some specific examples of how we apply that at MyPath. So communication, we've talked a lot about the need for continuous communication, continuous education. In our case, because we have a large number of employees, we do have turnover, so we always have new people coming in. We created a series of animated videos that explain employee ownership. And there are 10 of them. They're 4 to 5 minutes each. You can watch them on your phone, and then when you complete that series, because we can track that, our owners are given a certified employee owner or CEO designation, and they get a paper certificate, and they're very proud of them. They post them on their cubicles or in their homes, wherever they happen to be. So, one example on communication. On the area of voice, having a voice in the workplace. One of their recent initiatives, because it came from our owners, is in our field, traditionally one of the sort of problematic situations is clients with disabilities sometimes direct racial slurs to our owners. And I think the traditional view in our industry was that, well, they don't know what they're doing. They're not accountable. You need to just get over it. And what I've learned is that can be traumatic in two ways, both from the initial experience and then from the fact that the experience is dismissed by supervisors, by managers. So our owners came up with a training on those situations, how to handle them. They call it Owner Dignity Project, so that didn't come from me. And that's been very powerful to indicate to our people that, yes, we are listening, we are concerned about you're feeling valued and feeling included. And I didn't mention the composition of our workforce. We're about 45% non-white, about 75% women. So we are working hard on the certification that Lauren talked about. We're not number one, but we hope we can be number two, thanks to Leslie and for her assistance and the assistance of her team on that. So that's an example.
Thank you. And mystery solved. Terry just shared a little bit about what ownership feels like, looks like at this MyPath ESOP company. Curious, could you just tell us from the ground up, kind of what is ownership like? What does it mean for a worker owner, a cooperative member in your space?
In the home care space at Home Care Associates, ownership is me. And I say that because from the moment you come into the doors of Home Care Associates, you are introduced to the co-op. When new employees come in, they're actually interviewed by owners. employee owners. So they have a part in who's actually coming into the organization from the beginning. They also are a part of the training that gets to new workers. They are a part of in our organization, we have committees. We have a policy action group. We have a safety committee. We even have a happiness committee, which is great. We have a mentor program, and all of those committees are ran by the employee owners. The employee owners run those committees, bring it back to the larger of the employee owners. Our owners are the board members. Our board is set up of 12, 7 being the employee owners. We have a finance committee that's set up of majority of the employee owners. So in our organization, the employees really run the business. We have a CEO at our organization, and it's good to know that, like JC mentioned yesterday, there's an open door policy because all of us are owners. So we own the building, we own the offices, we can come in and, have meetings or look at finances and strategically plan new programs and things together. So in our organization, we are the elites. We really run the business. And the CEO comes in and she brings in her goals for the company throughout the year, but that all has to be approved by the employee owners. So in a sense, we are her boss. So in our organization, the democratic decision makings that we make, the governance that we follow really gives the workers the feel, well, not just the feel, we are the owners. And having that, they provide more quality of service when they're going to the consumers. Our consumers we provide service to are more involved in the work that we do because they're receiving a quality of care from an owner and not just an employee of the organization.
Thank you so much. Powerful. Katrina, well, I know that with Audria and JC and Terrell, we've heard from voices from some of the more robust examples of home care cooperatives nationally. I know you and ICA Group have done an important job of kind of documenting the entire home care cooperative sector. And I wondered if you could paint a little bit of a picture for us of the home care sector nationally, and then share a little bit about some of the new innovations in scale through secondary cooperatives you've been involved in.
Yeah, sure, I would love to. So I'm really excited because we just had a new cooperative that was incorporated just last week. And so we have officially hit a goal that we had set a couple of years ago of 25 worker-owned home care cooperatives by 2025. So, yep. Very excited about that. And we've set ourselves a goal of 50 by 2030. So we are really working towards a big push for scale at this moment. And I think we're really well poised to do that. So the 25 cooperatives that exist now are located in 10 different states and Puerto Rico. And we have a couple of states that have strong consolidations of home care cooperative activities. So Washington State just welcomed its sixth. That was the one that launched last week, Mariposa. So they have 6 home care cooperatives in Washington. There are 5 in Minnesota, and there's a scaled state-based initiative there. There's a state-based scale initiative in California that the ICA Group is really involved in, as well as a number of other organizations, Democracy at Work Institute, National Domestic Worker Alliance, Filipino Worker Center, and the California Domestic Worker Coalition. So that project is called Vivid Life, and we're working on a rapid replication model for home care cooperatives across the state there, and we'll be launching 4 new cooperatives as part of that project in just a couple of months. So we're really excited about that. But there's at least another dozen home care cooperative projects that are actively underway in about as many states across the country now. So there's just a lot of activity in this space. When I started now just a little over 8 years ago, I think there were 7. So this is a really exciting moment for us, and especially coming out of COVID. There's just been so much interest and activity in worker ownership in the home care space because caregivers were not treated well during that time. They weren't treated well before, and they're certainly not being treated well now. But it really just, I think the combination of knowledge about the model growing and just dissatisfaction growing with the conditions, has really led to a lot of activity. But in terms of the 25 that exist now, they're all women-led. Many are led by owners of color and immigrants, and they are primarily small businesses. So, I was happy there was some conversation in the last panel about like true small businesses, and that is the vast majority of businesses in the country, and that's very much the case in home care. So, over 80% of businesses in the home care space, have 50 or fewer employees, and so home care cooperatives are, very much in that space. Though we do have some larger outliers, including CHCA, and that's certainly a goal that we have for the sector is, not only growing the number but also growing the size of home care cooperatives so that they can be more resilient. So that gives you a little bit of a sense of what the home care cooperative space looks like now. And ICA is really involved in kind of a number of different initiatives. We have now for years been really focused on supporting the existing home care cooperatives that are in operation, making them stronger, making them more resilient, really getting to that growth path and growth mindset. Home care is an incredibly difficult business, very, very slim margins. And then also, growing startups and now really looking at scaled initiatives. So I mentioned that there's this project in California that's a rapid replication model. We'll actually be replicating under a common brand with common systems, policies, et cetera, with a shared secondary cooperative back office. So that's a new model that we'll be testing out, and we're really, really excited about that. And really what we'll be testing is, our hypotheses about how to address some of the challenges that we see that are replicated across the country. So we have been, benchmarking the sector now for 7 years, and we, have documented all of the ways that home care cooperatives are outperforming the broader industry, but also the persistent challenges that we're seeing year after year, state to state, et cetera. So that's one. And then the second, which is really, my love, is the development of Elevate Cooperative, which is a new national secondary cooperative for the home care cooperative sector specifically. And Elevate Cooperative will actually launch a formal membership program this fall. But we have for a number of years now actually been piloting a variety of different initiatives. We have a national online peer networking and exchange platform where cooperatives can share information and connect, et cetera. That's something we launched last fall, and a number of other programs. But really the idea is that, it's very difficult for home care cooperatives to compete. And there's a number of challenges that I can get into around that. But what we have as our competitive advantage is this desire to cooperate. And so really leaning into and formalizing cooperation among cooperatives and pooling our resources to be able to better compete with the traditional home care space. So there's a lot more I could say there, but I'll stop there for now, and we can talk more about that as we go along.
Thank you. It's an important innovation. A question really for any of you. In some of my own research on employee-owned businesses in the health sector, I found some really suggestive but still anecdotal evidence that when you embed workers in better support systems and you actually give them an ownership stake, that can translate into improved care for patients or clients. I was just curious, Terrell, Terry, Katrina, any examples you could think of, or is that, in your experience, is that true? And any examples you can think of how ownership could potentially translate into improved care?
I have several examples of that. Before I started home care, I was a certified nursing assistant working in a nursing home. And one of the things, and I was just a person there at that time, because I'm fully engulfed in co-op at this point. But while there, I was told that I could not go into the rooms and hold conversations with the residents longer than 5 minutes. When you go into the room, you announce yourself, go in there what you're in there for, don't spend long times in there talking to the residents. That's what they do at the community room, but not in their rooms. I talk a lot. I like to crack jokes and dance for people, so I found that that was hard for me because I could not connect with my consumers. When I got to Home Care Associates, first, I must say, in the co-op world, we are a collective. A lot of my initial trainings to be the director I am today, I got for free from Cooperative Home Care Associates. Because they were the largest co-op and our model was built from theirs, they shared all of their knowledge with us, trained the workers to be where we are today and further and continue to do that. So when I got to Home Care Associates, the first thing that struck me is when I came in, they said my name. And I didn't know these people, and then they gave me a hug and they gave me food, and it was really nice. But when I got to my consumers' homes and I'm, in there doing my work, and I found myself conversing with my consumers, and I got appreciated for doing so. And I was like, wow. And they said, well, Terrell, you got a really good rapport with the consumers. We want to send you over to this one, and maybe you can talk with her and help. So now I'm being asked to go in and talk with people where I came from, you can't talk with them more than 5 minutes. So when you are given some ownership in the work that you do, you tend to put more quality in the work that you do, and is supported to do so because it's quality jobs, quality care. So in the quality of my job, it pushed me to want to give more quality of care because it was expected.
If I could follow up on that. So if you look at the data produced by NCO or Rutgers or the other groups about financial outperformance by ESOPs and employee ownership, that's great data. I would love to have similar data in the healthcare space. I don't think we do yet. In our case, we're in that subset or that niche of healthcare where quality has not really yet been totally defined in a standard or uniform way. We have accreditations, so we achieve accreditation in different areas, but that's kind of a baseline. So, and that's actually been a topic in our peer networking group under the auspices of NCO. We have a small group of healthcare companies that get together, and it'd be great to have that data. So you could produce that.
Together. I think I'll add as well. I think this is such a tricky one. It's something that we're very aware of, that we need more data on the client side. I think in particular to be taken more seriously, though we have tons of anecdotal evidence from clients who express how different the care is from cooperatives. And what we do also have is data on the caregiver side. So Audrey touched on this earlier. So home care cooperatives have an annual caregiver turnover rate of only 30% versus the broader industry, which is 79%. And that relationship and that consistency that's created by a caregiver that is showing up day after day, is building rapport with clients, knows their needs, their wants, their specific ways of wanting support, because it is quite a client-centered service. That produces a higher quality experience. And so that's a key factor, is the turnover rate, and the turnover rate directly relates to caregiver tenure. All of the cooperatives have examples of numerous caregivers who have been employed with them for years, decades, et cetera. And the other that we do know is that client tenure is longer. So that is a piece of data that we have, that client tenure at home care cooperatives is more than double the industry average. And so we do all of our benchmarking. We compare against what's now Activated Insights, which is a great report that looks at the broader industry. So I think we have a lot of data indicators, but it would be great to get more on the client side, and it's something that we're certainly thinking a lot about. I think the challenge is that the way that, it's typically looked at is rehospitalizations and things like that. And that's such a tricky data point, because actually going to the hospital could be an indicator of better care. And so I don't think the industry as a whole has figured this out. It's kind of a challenge that everybody is dealing with, cooperative or not. And so we're not unique in that way, but we're trying to figure that out so that we can have more proof on the client side of kind of the cooperative difference to the client experience.
We definitely need better measures. Let's see. Oh, I guess one more question, and then we'll turn it over to some Q&A. We've talked about how this home care, residential care are quite low margin sectors, and in part, it's an economic space that's very much constrained by policy and like Medicare, Medicaid reimbursement rates and such. So just curious, as we're talking about quality of jobs and also quality of care, if any of you have thoughts on sort of policy solutions, regulatory solutions that could help kind of undergird this higher job quality, higher care approach, shared ownership approach, like what policy solutions, regulatory solutions would be helpful?
Well, that's a big one. In our case, we have, last count, 230 different government funding sources, and that's a lot of policy to keep track of. But I would say one of the themes that we run into, frankly, is overregulation. No offense to Hillary, but there are situations, and we see this more at the state level where we're involved, but you might have situations with poor quality providers, incidents occur, and then the immediate reaction is to regulate. Like, oh, what this means, we just need more rules. That's totally disconnected from funding, and those two sides do not talk to each other. So, dealing with that. And then the other is more support for technology. And we are not early adopters of technology, but when we look at the workforce situation, demographic trends, we have to come up with technological solutions to take away the tasks that divert from client care. And I think there are a lot of opportunities to do that. And again, regulators do not necessarily see that or are not familiar with systems that are available today. So those are a couple things I would mention.
I would add to, if there's a way to make it feasible for worker home care co-ops that have the same access to funds as non-traditional agencies, without that personal guarantee, because the guarantee is already here, it's proven. We are the workforce. We are the owners. To make that easier for us to gain, to put that back into the workers, whether it be in money and training and those things, if there was some way to have that policy a little more clear for home care co-ops, it would take a little weight off of us. Because we're always innovative because the workers have ideas, and getting over those struggles and being able to persevere like we did through COVID by leaning on each other. But if we were able to get those funds, it would have been a lot more easier.
Right. That, like, access to capital,
Access
like the
to
earlier
capital.
discussion
Yep.
about, okay. Thank you. Katrina, any additional?
Yeah, well, the big and obvious one is we need more public investment in home care, through Medicaid, Medicare. We'll see if and when that happens, but sort of in the absence of that, or in the meantime, right, we can't sort of sit back and wait for that. We need to be finding other ways to get creative and get more investment into the field and into the job. So I think, what would be great would be preferential contracting for employee-owned companies or home care companies that are investing in job quality. Not all home care agencies are created equal, absolutely not. And those that are investing in training and ongoing education, so that's a big one. I do think workforce development came up on one of the other panels, and there are no national standards for home care. So in some states, you can quite literally get employed and just walk into a home and start caring for someone, and that's crazy. And other states have very low barriers and others much higher. So there's no standards and there's not enough investment in training in general. So I would say that's another area, and workforce development might be one of the places to do that investment. The personal guarantees is another. And this is a little bit different than the policy question, but I'm going to steal the space here for a little soapbox, which is also that we even find actually from foundations and funders, there's often a lot of pushback in investing in home care because home care jobs are considered bad jobs. And so there's this thought, well, no, we don't want to invest in home care. We want to be moving people from home care into other jobs that are higher paying. But then that sort of glosses over the fact that home care is a huge need, that it's one of the fastest growing professions in the country. And so if we just don't invest in that, then we are making a statement really that we are okay with having a whole population of workers that are just going to be low wage and not invested in. So I think that there's a policy changes that are needed big time, but also we need to change our thinking in general around how we're investing in this workforce and how important it is, and sort of at all of the different levels.
Thank you for that. Friends, we have time for just a question or two. Any questions? Terrell? Yes. Oh, I'm sorry. Yeah.
Hi, thank you. And I'm actually with a healthcare provider in California, so I would love to learn more about your co-op and how you guys are working together with other co-ops, and would invite you to really have that quality data. I mean, that's our driver is being able to provide high quality, affordable healthcare. And while we don't provide, home care to our members, as an insurer, we pay for it. And so we would like to see that. And I'm an advocate in our organization for preferential treatment for home or cooperatively owned or employee-owned home care providers because of the quality element, the job quality, and how that promotes upstream health. So I'd love to connect afterwards.
Wonderful, thank you.
Any other questions? Got one more. Hillary.
Actually, not a question, but a comment. It is just so inspiring to hear. Thank you for laying out those numbers, Katrina. 7 home care co-ops 8 years ago, 25 today. We'll double that in the next 10 years. So just congratulations and thank you. It's remarkable to see the infrastructure you've built through cooperation among cooperatives, through the excellent support of the technical assistance providers like the ICA Group and Dowie. And we need this in home care, and wonderful to hear about your ESOP as well. So just thank you for the work and keep it up.
Thank you.
Thank you, Hillary. Last question, sir.
Thank you for the interesting presentation. Now, instead of asking, I'm glad you came to a question as to whether or not employee ownership would improve services, because in DC, where I have some experience of receiving home health care, so it's not a very good, even though they are all licensed, and the licensing process is also a little corrupt. Given that, I would like to ask Terry, how did you resolve your racial slur problem? Just kidding.
Well, I don't know if we solved it, but we've taken some steps to try and address it. I'll put it that way.
Because it has to be somebody very crazy to use a racial slur, or somebody who has been oppressed to such a point that they've gone.
Well, the reality is some of our children or adults that come to us, to our programs, this is what they've heard all their lives. This is their families. So it's not a quick fix.
I'll add some good news, which is there's a home care cooperative in development in DC. So hopefully coming soon.
Friends, thank you. Tremendous thank you to the panel. Round of applause.